October is Breast Cancer Awareness Month, which is an annual campaign to increase awareness about the disease. Our medical expert, Dr. Kevin Campbell, joins us now. Good morning, Dr. Campbell.
Good morning.
Great to have you back on. Breast cancer affects 200,000 people each and every year. When I say people, this is men and women that we're talking about. So what is breast cancer?
Breast cancer occurs when we have abnormal cells that grow within the breast tissue.
Okay.
It becomes malignant or cancerous, and these cells take over the normal tissue. They can spread to other tissues and cause lots and lots of problems. It occurs because there's damage to the genetics or the DNA in those cells.
Okay, so for people out there, men and women who want to know, am I at risk for developing breast cancer? What are some of the risk factors?
There's certain things you can't change. You can't change your gender. Women are certainly more at risk than men. You can't change your race. Caucasian women are more at risk than other ethnicities. Also things like family history of breast cancer, genetic predispositions. But there are things that you can impact. Diet, exercise, obesity, smoking, all of these put you at higher risk for breast cancer.
Yeah, so we're talking about prevention. You are what you eat, and it's really important that you're eating healthy. So what are some of the other ways that we can prevent breast cancer?
Certainly we've said it on this show a million times. It's all about diet and exercise, making sure that you live a healthy lifestyle. But beyond that, I think that, partnering with a healthcare provider, understanding what your risk for breast cancer is, making sure you get regular screenings. There is some controversy. Recently, the guidelines have changed. Now we're saying that women over the age of 50 and under the age of 74 should have mammography every other year. It used to be more frequent. If you have a family history of breast cancer, we're going to want you screened more aggressively.
All right, so that's what you're recommending. You talked a little bit about prevention, but let's talk about treatment. Is the medical industry making strides in the way they treat breast cancer?
Absolutely. Because of early detection, we're able to use less toxic therapies for breast cancer. Certainly there's radiation therapy, there is chemotherapy, and there are surgical approaches as well.
And get checked, especially if you've got that family history.
Absolutely.
Dr. Kevin Campbell, thank you for making us aware of what we all need to know about breast cancer during Breast Cancer Awareness Month this October.
Thank you. Wear pink.
That's right.
Raising awareness for all the breast cancers out there.
And if you want to reach out to the good doctor, you can do that. Go to WNCN.com. We've got all of his information for his Facebook page as well as his Twitter page. Great to see you again.
Good to see you.